Hello everyone, and welcome to this audio podcast. This audio podcast as part of a fandom edition. This audio podcast is part of a Labostix Machina. This audio podcast is as part of a Vertex Relay. This audio podcast as part of the Abstrax, and this audio podcast as part of a Storm Labostix production. And through this audio podcast today, I look at the abstract as part of original research from 2015, around 2015, 2016, collaborative works looking at original research and the abstract in regard to coping in young people with chronic kidney disease or CKD. Um, the collaboration was between two sort of main academic institutions in the United Kingdom and a youth club based in the United Kingdom, and also a social media platform, and one National Health Service trust, or NHS trust, in the United Kingdom. In the United Kingdom, the abstract in around this works coping in young people with chronic kidney disease (CKD) from 2016 was and is as thus. Chronic kidney disease (CKD) is an irreversible disease with physiological, psychological, and psychosocial implications, especially for young sufferers. The objectives of this phenomenological investigation was to identify coping strategies in two cohorts of young people aged 12 to 18 years. In one cohort, the young people were healthy, and in a second cohort, the young people had CKD. The young people who were recruited and participated had CKD, or chronic kidney disease, on the severe side of the condition. CKD stages for CKD stages, or chronic kidney disease stages, or severity of 4 to 5 rather than 1 through 3. In around the methodology, young people with CKD stages 4 to 5, where there were seven young people who were recruited and participated, where the mean age was in around 11.5 years, of age, and young healthy people in the second in the young healthy people cohort, where there was another seven young people who were recruited and participated, and the mean age was 14 years, where the children or young people with CKD were recruited and participated from a children's hospital in the United Kingdom, and the young people recruited and participated from a youth club based in the United Kingdom, and were invited to take part in one face-to-face semi-structured interview. As part of the main sort of findings, or sort of the basis in around the findings, the data analysis showed 11 different coping themes, and in regard to the conclusions, it can be concluded from the interviews that young healthy people, and those with CKD, chronic kidney disease, alike utilize a range of coping strategies. The themes derived can prompt investigators or researchers to potentially develop a sort of measurable framework for a young CKD population, or chronic kidney disease population. However, a longitudinal investigation or study would help to recognize coping strategies young people adapt over time, and provide a pathway for development for a formal coping framework. That some key some main terminologies that can be utilized that can be used or utilized to identify similar works include chronic kidney disease, coping, phenomenology, and young people. That draws this audio podcast to a close. This audio podcast is part of a Phantom edition. This audio podcast as part of a Labostix Machina. This audio podcast as part of a Vertex Relay. This audio podcast as part of the Abstrax, and this audio podcast as part of a Storm Labostix production.